fun, the sound effects are neat, and the host ain't so bad either. Please join me for the 90-Second Naturalist.
Listen every weekday afternoon during the KSJE Evening News at 5:30.
Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Monday, July 20th.
It is. We're in the 20th week.
No.
Yes.
Really?
Yes.
Okay.
I'm your expert on counting.
I know
down,
you are.
trust
That's
me.
why I am a little shocked that we are on the 20th week, because it's the 20th day of 2020 of the 7th month.
Whoa. Yeah.
There you go, everybody.
That's taking a while.
Our
to click over
numerology
here.
experts
Wow.
will be calculating that during the whole show.
Yeah, exactly.
Yes.
We're pretty innumerate in this room.
Yeah.
I think.
Well, yeah.
I am.
Anything close to math, no.
Counting on my
Forget
fingers.
it. But yeah, anyway, welcome. It's great to have everyone with us. It's, like I said, Monday and 20th week, and here we are on our local information program about COVID-19. We have some great guests lined up. In fact, we should probably get to them right away.
There's
we'll
one on the phone right now.
talk about the numbers here in a moment.
Yeah.
But good morning. You're on KSJE. Thank you for calling in this morning.
Good morning. This is Bill McCamley. I'm the Secretary of the Workforce Solutions Department.
Secretary McCamley, we're glad to have you on the program. Thank you for calling in.
Sure. Is this where I should say I'm the seventh son of the seventh son?
Yes. Yes, that will send us over the edge.
That's a lie. That would have driven my mother completely bonkers. So.
Oh, okay. Well, that's all right. But thank you. The fact checkers were checking as you were saying that, so we would find out that eventually. But Secretary McCamley, we're glad to have you call in from the Mexico Workforce Solutions, and so we kind of wanted to have you on the program to talk a little bit about the economy. We know unemployment is high in our state as well as a lot of other states, and kind of get your take on what's going on, if the state is ready for recovery, if we're already in some part of recovery, or just give us your feel on what's going on these days.
Well, our focus has really been on making sure that our systems have been good enough to get people their unemployment benefits. We are in an unprecedented situation in terms of the amount of people that are receiving benefits. In the spring and March of 2009, it was the height of the Great Recession in New Mexico, and you had 67,000 or so people receiving benefits. We just got the numbers this morning, so for last week we have about 171,000 people in New Mexico that are receiving benefits. That is actually a fairly big jump. It hovered between 150 and 157 for about 2 months. What you're seeing now is probably a combination of the last of the folks who were working as servers in restaurants when indoor dining was stopped, getting on unemployment. Plus, there's a lot of people that understand that as of now, this is the last week that you can get the extra $600 payment from the federal government on every week of unemployment. So I imagine between last week and this week, you're going to have a lot of folks really trying to get that as much as they can. The real message, though, here is, look, we as New Mexicans control how much and how fast the economy opens back up. The governor has been very, very clear about that. And if we wear our masks, and we socially distance, and we don't go to graduation parties, and we don't go to baseball tournaments in Arizona and all these other things that you hear about where people are getting this thing, then we control the spread. And that does three things, right? Number one, it keeps us all healthier. And as you're seeing, there are more and more hospitalizations around the country. The death rate is going back up again. You're starting to see a lot of health effects that people might not have had or known that they were going to have before. So a lot of younger people are seeing scarring on their lungs to the extent that they have to use inhalers or have trouble walking up stairs. You're starting to see, frankly, some medical evidence that fevers can affect men's reproductive organs, just like the mumps does. And I don't think a lot of fellows who are not wearing masks understand that in order for things to go well, you need to not get this thing. But that's number one. Number two, when that goes down, then we can open back up the economy. And Governor has been very, very clear that the spread and how much that goes down so that we can keep New Mexico safe will really drive how much businesses can open back up. And the third one's just as important, and maybe even more so, is that we will help our healthcare workers. Many of our hospitals are starting to get very busy. I don't think we've got a situation in New Mexico, thank God, yet where we're overloaded. But you are seeing in Arizona, you're certainly seeing in Florida, where their hospitals are being overloaded and their healthcare workers are burning out. I'm actually from Las Cruces, and a couple of weeks ago in El Paso, one of the hospitals had to shut down one of their freestanding emergency rooms because they needed doctors back in the hospital, and they just didn't have the medical, the doctors and nurse rotation that they needed to take care of this thing. So it's up to us. How much and how soon we open will be completely based on our actions. And if we do the right thing, if we wear masks, just this morning in Colorado, you saw a report out of Colorado where in areas where people wore masks, the spread was way down. And so if we wear masks, if we socially distance, we stay away from one another, we all know what we have to do to get this thing down by now. If we all do those things, people are going to get back to work, and that's what we want.
Right. And I want to circle back around real quick to the benefits. I believe that the unemployment benefits during this time had jumped to $600 a week. And now, as you mentioned, those things are fading out. And so what does that look like? Are we going to go back to the way that unemployment benefits used to work? And how did they used to work?
So unemployment benefits have always worked the same. And so when you apply for unemployment, if you are eligible, you are given what is called a weekly benefit amount. And that dollar amount is based on how much you've worked over the past 18 months. The more you've worked, the higher your benefit amount, because our trust fund, which pays out unemployment benefits, is funded by payroll taxes, right? So your employer pays it in. And if you work a lot, your employer is going to pay more payroll taxes in to boost the fund up. If you didn't work as much, not as much in the fund, your weekly benefit amount is lower. What the federal government did in the CARES Act of late March is say that for everyone who is getting any weekly benefit amount, you get an additional $600 on top of that. So if my weekly benefit amount was $250, that's what I would normally get, I would then get $850. As of now, and I know Congress is in discussions about if and possibly how to extend those benefits, but as of now, this week will be the last week that you qualify for that extra $600 if you're on unemployment, which means next week you get the check. Because in unemployment, you always get your check the week after you qualify. And so next week will be the last week, as of now, that people will be seeing that extra $600, unless there's an extension. And I know they're starting to talk right now about what that might look like. The administration does back some kind of continued benefits. It's been a lifeline for people that need the help in terms of paying their rent, getting their groceries, making sure they can function in this economy as the pandemic has spread. It's allowed a lot of people to stay home when normally they might not have been able to. Furthermore, even if we start opening the economy back up, some of the jobs that maybe people have had in the past at movie theaters, large-scale events, that sort of thing, they're not going to be there. And so making sure that people have the resources that they need to get through this is very important.
Right. And Secretary McCamley, let me ask you to maybe put on your crystal ball or look into your crystal ball and take a look at what do you think the Congress might do about those extended benefits? Are we going to see those come through for some of these workers that have really been depending on them? As you mentioned, it really has been a lifeline for a lot of these service workers who have had to be laid off.
So if I was in Congress, I'd be willing to tell you, and I ran in 2008 and was beaten, which has probably turned out to be one of the better things that has happened to me. But I'm not in Congress, so I can't tell you. I know that there's some pretty impassioned feelings on both sides. The House of Representatives actually passed an extension 2 months ago, 3 months ago, somewhere in there, where they wanted the $600 benefits going through January. I know the Republicans on the Senate side don't really want that at all. And so it's just going to be a give and take. And there's the way this works in any kind of legislative body. And I was in the State House for 6 years, so know the general process. You've got people that want certain things. For instance, Senator McConnell in Kentucky has been really, really adamant that he wants liability protections for business. That seems to be one of his big things. I know that the HEROES Act, which was the bill passed by the House, contained extensions for unemployment and also help for state and local governments as they have some real issues during this time, trying to figure out how we're going to fund schools, how we're going to fund police, how we're going to fund firefight departments, all those folks that rely on gross receipts taxes, which right now are down because people haven't been spending as much. So all of those things are going to be rolled into a series of negotiations. One other thing that they're bringing up is early childhood and child care situations along with schools. How do you work with schools to make sure that they have the resources they need if they decide they want to open back up and not just do virtual all next semester, that they have the resources to provide teachers and the administration with safe environments? These are really, really important, valid, critical questions, and they're all going to be wrapped up in a negotiation that also includes the extension of what they're calling the supercharged unemployment benefit.
Right. And Secretary McCamley, let me ask you a little bit about, as you mentioned, if folks really want things to reopen and we really want kids to be able to go back to school safely and folks to be called back to their jobs, in order for them to do that, it seems the way forward is to wear the masks, practice the social distancing, and do all these things that the state and the governor is recommending in these public health orders. How do you see the state moving forward? Do you see things start to reopen here as we get into the fall and winter, or is that something that you're cautiously optimistic about happening if everybody kind of follows these guidelines and we see the numbers? Again, our numbers in New Mexico are not anywhere near our neighboring states, and for that we're very grateful, and our hospitals are not nearly as overwhelmed as they are in our neighboring states, but give us an idea of what you see happening a few months down the road.
Well, I think that'll be up to New Mexicans. That will be a decision that New Mexicans make. Do New Mexicans decide to wear masks? That is the simplest but one of the most effective things that we can all do to slow the spread here and get things going back to normal faster rather than sooner. And it'll be up to New Mexicans. If New Mexicans wear masks, and this has become a political issue for some reason, and I don't know why, but a mask shows that you care about your community, because masks give you a little bit of protection, but more so if you've got this virus, and some of the medical studies are saying up to 40% of the people with the virus are completely asymptomatic, they're the ones that are spreading this thing. If you wear a mask, the risk of you spreading this virus to other people is a lot lower. And so wearing a mask shows you care about your teachers and your cops and your folks working in the grocery store that are out there busting their tails for you day in and day out, your healthcare workers, all those folks. And so it'll be up to us. And if we do the right thing, we wear our masks, we kind of social distance and stay home as much as we possibly can, then hopefully the spread continues to go down. Here's the other thing, though. You talked about hospitalization rates and the fact that ours are less than our neighboring states. That's true, but it's because the governor took swift action in March and closed things down earlier. It's because we've had a statewide mask order in place earlier than other states have had, and people have started doing that. So to those of you that are wearing masks, the businesses that are opening up following these COVID-safe practices, thank you so much. You're the people that are going to get us back on track. And then once those numbers come down, it'll be up to the experts. Look, I trust science. I trust the people that study these issues their entire lives, the epidemiologists and the scientists. And if they say, hey, look, we feel comfortable, as what happened in the beginning of June. We were on our way down, and the governor said, look, we feel comfortable with some excess risk, and so allowed restaurants to open back up, gyms to open back up. But unfortunately, what we saw in June are those numbers started to really rise again. Not only the cases, but the hospitalizations, and that's a real issue. And so you say, hey, look, okay, what is the one environment where people are inside not wearing masks, which are two of the things that contribute most to the spread? And unfortunately, that's indoor dining. And it was really interesting at the end of June, Chase Credit Card Company actually did a study and found that one of the biggest predictors to increases in COVID-19 were how many people spent how many dollars in restaurants. And if you spend a lot of dollars in restaurants in your community, weeks later, it predicted that there would probably be a rise in COVID-19. Whereas if there was a higher rate of people spending in grocery stores, what does that mean? Folks are staying at home, they're social distancing, the rates didn't go up. And so unfortunately, that was one of those situations where the health folks had to make a decision. And it's hard. It's hard. And if we want restaurants to open back up, we need to do a better job of wearing masks and social distancing. And if those things happen, hopefully we can get back to normal. But I can't make a prediction. No one can make a prediction. The virus drives the decisions that are being made, and our decisions are determining how much the virus spreads.
Very good. That makes sense. And so just as we wrap up here, I have a question about some industries, of course, are being hit harder than others. And some industries actually might see an increase in business. And so I'm wondering, part of the Workforce Solutions is job training, right? And keeping an eye maybe even on new jobs and job creation. Can you speak to that?
Yeah, so there's about 4 areas that we see at Workforce Solutions that are going to be gaining a lot of jobs in the state over the next decade. Education, we need teachers like crazy. The teaching population is generally older, and many of them are going to be retiring in the next few years, no matter what happens with COVID. And if you want to be a special education teacher, if you have bilingual skills, if you can teach math and science, the education folks need you. And if you've ever thought about going into teaching, there will be jobs, I promise you, open in the education sector. The second one is healthcare. We need people across the state in every area of healthcare, from nursing assistants to brain surgeons. And if you've ever thought about being a nurse, being a nursing assistant, being my girlfriend is actually a MRI tech. She's a radiologist. Then you can get a job pretty much anywhere you want to go, and those jobs are going to continue to be available in the long term. The third is construction. Actually, if you look at the unemployment numbers for June, construction was the only area of the state where we actually saw an increase in about 700 jobs in the state. And so if people want to go get a skill set in welding, in carpentry, in plumbing and pipe fitting, sheet metal working, that sort of thing, then you're going to be able to find a job even right now. There's going to be a lot of jobs open for you. And the last is going to be STEM and IT. We need engineers like crazy. We need computer programmers like crazy. There is a huge booming market in cybersecurity. You know, you see Zoom out there, and you saw early in the pandemic, as people started using Zoom, what happened? All the accounts got hacked, right? So you've got an opportunity to be able to find a long-term job in cybersecurity if you want to go back and skill up. And so what we're working on right now is really finding the avenues, if people are interested in starting to look and pursuing these, about where they want to go. So for most of the construction trades, you can go get an apprenticeship. And we've got all the apprentice lists in the state on our site at dws.state.nm.us. And if you want to go to be in healthcare, a lot of times you don't have to get a doctorate. You can get a 2-year certificate, or associate's degree in one of these healthcare fields. You can get a 3-year nursing degree. If you want to go into STEM and engineering, sometimes you do have to get a bachelor's degree in engineering or computer science, but sometimes you can get a 9-week boot camp in a programming language and be able to get a job from there on out. So these are the opportunities that are out there for folks, and we're starting to look at how we market them. But at the same point in time, we've got to strike a balance, because right now, you're still seeing a fairly high number of cases throughout the state of New Mexico. Lee County, of all places, yesterday had the second highest numbers in the state at 35 cases. And so this thing is still spreading, and making sure we get a control of it so we can protect the health and safety of New Mexicans has to be the number one priority for now.
Very good. Well, Secretary McCamley, we appreciate your time this morning calling in, and thank you very much for your expertise and for talking with us and our listeners and viewers this morning.
Yes, sir. You guys have a very good morning. Keep your heads up, okay? And
You
wear a
too.
mask.
Yes, indeed. You too. Thank you so much. That is Secretary Bill McCamley of the New Mexico Workforce Solutions Department, our guest here on KSJE and our COVID information program. We appreciate him very much calling in.
Yes.
First
Love
time
it.
we've talked to him. Mm-hmm. So there you go.
Love to ask economics questions.
Right?
Nerd.
Yeah,
Nerd.
I know.
Cool. We have another caller.
We do have another caller on the phone. Good morning. This is KSJE. Thanks for calling in.
Yeah, Scott. Scott, this is Gene Schmidt calling in from Farmington Municipal Schools. How are you doing?
We are well, Dr. Schmidt from Farmington Schools, Superintendent. Thank you for calling in, and we appreciate you doing that because we've just been talking to Bill McCamley a little bit about the Workforce Solutions Department, and of course he mentioned that in order to get things we want, businesses to reopen, schools to reopen, things like that, the public health orders are devised to get us moving in that direction. Farmington Schools just last week adopted your Return to Learn plan, and so since you're the largest school district in our community, we thought it'd be good to have you on the program to talk a bit about how you came about to that decision, how the school board came about to that decision, and what it looks like. So can you run us through it real quick?
Yes, I would say that the cabinet and I presented an instructional model that we recommended to the board that consisted of an at-home and at-school learning. So let me pause for a second and do a sound check. Am I coming through?
Very good, Dr. Schmidt. Thank you.
Very good. We both were like, yes, we concur.
Yeah,
Yes, so, right, you guys have been working hard. I know as a parent, I got a parent survey, and maybe you can speak a bit to the purpose of the parent survey and maybe what kind of data has been coming back from that.
Yes, and it's both great questions. First, for our listeners that maybe were not tuning into the school board meeting last Tuesday when I made a recommendation to the board for an at-home learning and an at-school learning model, we proposed that both models would have a 5-day learning component, but the at-home would be online, and the at-school would be 1 day of at-home and at-school learning. So let me pause there for a second. So that is the question that we are posing to our school community families, is if given a choice between at-home, which means an expanded version of online learning, or an at-school return to learn, we would be interested in knowing what those choices would be. We've been surveying parents Wednesday, Thursday, Friday of last week. We're continuing in today. And Scott, you'd be interested in knowing that we've had so far a 59% survey response, and that's 6,195 kids have been surveyed so far. And what we're finding is about 18%, in this case, of those original 6,195, 1,115 students would prefer the at-home learning. So it breaks down a step further. Again, 59% of 10,500 kids have been surveyed. So we still have a long way to go, about 40% more of our kids to survey. But what we're finding is 82% of our community would like to come back to school. And so I know that that would please Bill McCamley. And in the original guidance from the state prefers a 50-50 hybrid model where half the kids come back 1 day, maybe half the kids come back. That's a different model that we presented because we wanted to bring kids back 4 days. And so the 82% factor is probably running at a little higher than our capacity. So I'm interested when we get our final results, all 10,500 kids, what that will mean. If it holds at 82%, then as I told the community, then we have to think a little bit differently. And obviously the first thing would be is how do we make more space and then try to find teachers to accommodate that need. So I'll take another question and then I'll continue what we're proposing.
Great, wonderful. So my question was obviously we went to spring break and then it was the spring break that we never returned from. So you guys had to adjust very quickly to online learning. And I want to know, have you debriefed and figured out what are some key lessons that were learned or skills that were acquired that can help us move more prepared into the fall?
Yes, and that's a great question, and I appreciate that because we did learn a lot. And I'm appreciative of the fact that you acknowledge literally the governor declares we're going to be closing down on a Thursday. We are able to mobilize and send 11,000 laptops home on a Friday. We had a spring break, and then we geared up for what we thought might be 2 more weeks of home learning that eventually became 45 days of at-home learning. What we learned from the first, I'll call it last spring, it was really a focus on not being sure how long at-home learning would take, so we focused on maintaining connections, teaching a little bit of content, but more importantly, reinforcing the skills that kids may have not have learned during the third quarter. You'll recall that we had a grading system that says you are going to pass or get no credit. Well, any student that had demonstrated passing up to the third quarter continued on learning, but was given a pass. Those kids that had not mastered by third quarter were given a chance to make up work and demonstrate competencies. So it's really a question of just sustaining the learning that they had through the third quarter, introducing a little bit of new material, but more importantly, trying to make home connections and being careful of the social, emotional, behavioral well-being of kids. So now it's a different world. In the new online learning program, it's going to be a whole lot more parallel universe with what is taking place at home. And at school will look the same. Grading will look the same. Pacing guides for the curriculum will look the same. So what we're going to do is we have moved everybody up to their next grade level, and we're going to, both through at-home learning or at-school learning, accelerate the pace of learning so kids will be at the next grade level next year, but more importantly, we have to backfill all of those gaps that we would call. So I appreciated your question. In probably the first month or two of school, you're going to see a lot of something called quick checks. Teachers will try to figure out where kids are in their learning by doing lots of quick check questions. Kids will call those common formative assessments, but we're going to be looking for ways to, just spot check kids by questions that over those first couple of weeks or months help teachers, okay, where are the gaps, even as you're now in that upper grade. So I think it's a strategy that we think will be effective and help us get kids and teachers at a learning pace that they can not only catch up but be up and be prepared for another grade level in the end of the year.
And Dr. Schmidt, I wanted to ask you, too, a little bit about the feedback you're getting from your teachers throughout the district. You've reached out to your parents to find out what they feel like about fall, but what are you hearing from your teachers? Are they comfortable with these plans? Would some rather still do online learning, or do others feel comfortable getting back into the classroom face-to-face with the students in this different plan that you have proposed?
Yes, and that's a great question. So envision a staff that maybe about 1,400, maybe 1,500, of which a bit more than 700 are teachers. We have sent out through the HR department a survey to teachers and staff saying, what health reasons might prevent you from coming back? And of that original survey of about 1,400, we identified about 119 that had some health concern. And since then, as we have introduced this plan, more of our teachers who had originally called in with some concerns are expressing an openness to return to teach in person. Certainly we're going to identify with what I anticipate will be over 2,000 home learners. That will require about 70 teachers. And so there is plenty of space for those that would choose to be online teachers, as well as for those that would choose to come back and be in person.
Yeah, and I want to ask briefly about space adaptations, or just the physical adaptations that are going to have to happen in schools. And so can you tell us a bit about that? Because there's going to have to be, obviously, some major spacing issues, and that seems really difficult to parse out. And so what are you guys' thoughts on that currently?
And that is a focus of our attention. We have the school safety that has been renamed Return to Learn as we get ready for the start of the school year. But they've literally walked every school, all the classrooms, trying to identify how might we reorganize classroom space? You know, if you were to walk a classroom, you might see beanbag chairs, a teacher rocking chair, some kind of little corner where rugs are thrown down on the floor where kids have a reading circle. Oftentimes, classrooms will have kidney-shaped tables. So we're doing a survey of every classroom to see how we might reorganize by moving furniture out to focus on student desk space. Right now we're looking at a 6-foot distance, which allows us to, depending upon class size, put about 12 to 15 kids in a classroom. So that's the focus of this week as we begin to figure out, okay, if we got 82% of our kids back, that's about 8,000 kids. How do we, and I don't want to use the word declutter unkindly, but how might we reorganize a classroom space? In addition, we're also looking at how might repurpose cafeterias. Many schools have little gathering spaces. How might we repurpose a gymnasium as maybe wall it off in some partition thing to be 5 classrooms? And so we're going to be looking at classroom space first in the space that we have. And then as we try to meet the enrollment demand or that enrollment capacity, we'll look to other kinds of classroom spacing.
Gotcha. Very good. Well, Dr. Schmidt, we appreciate you joining us this morning, and I know you and I will talk more in detail about some of these plans when we get together on the 8 o'clock program next week.
Yeah, we're gonna know a whole lot more by next week, but I do appreciate the chance to reach out to the town, and I would say, if you give me one more minute, is that, you know, sometimes we can't get a hold of parents because their contact information has changed, telephones, emails, and things, and so if you're among that 41% that we've not contacted yet, you know, go on to Power School and check your parent contact information, or give the school a call and tell me where you're at.
Very good. And I think that's important information at any time, not just during a pandemic. So thank you, Dr. Schmidt, and we'll look forward to talking to you next week.
You betcha.
Thank you. That's Dr. Eugene Schmidt. He is Superintendent of Schools with the Farmington School District, our guest here on Ksje. And I think Dr. Schmidt's advice probably bodes well for all school districts and parents. If you haven't been contacted by your child's school, check that your contact information is still up to date on their software systems and whatever they're using to reach out. Because I think all school districts are trying to reach out to parents to let them know what's coming, what's going to happen.
For sure.
Or
for sure.
get their opinions. What do you
Right.
think should happen?
Right.
So there you go.
If you're still using AOL,
Yeah,
now's the time
that's okay.
to switch.
Well, just make sure that school
Make sure
has
it's
your
updated.
make sure the school has
Yeah.
your information. But 10,000 kids, that's a lot of kids that you got to deal with
Yes.
and accommodate, and a lot of parents.
That's right. And
So-
if you've been used to doing this for decades and decades and decades, I mean, really, public schools haven't changed that much over the years. They might have given every kid a laptop, and there might be these smart boards and stuff instead of an overhead projector. But the way we've done school has been pretty static. So we're talking about some major changes over the course of 3 months.
True.
Yeah.
Well, true. And I think from what you mentioned, too, after spring break, a lot of folks maybe learned that maybe their child is a pretty good online learner, or maybe they're just the opposite. They're not a good online learner, and so this is a chance to maybe try to figure out then what's going to work best for their child in the fall.
Correct. You
With
probably,
these
my
plans.
hunch is that we've all learned a lot about our children the past few months.
Right.
Across the board.
I think that's probably true.
yeah.
So there you go. But we thank our guests for calling in and sharing again.
Yes.
Local information,
Yeah.
which is what we're here for.
Good
So-
expert guests. yes.
Exactly. I want to talk about testing this
Yes.
week as we move on to show a little bit about the schedule. This morning we saw activity here at San Juan College. Again, the testing was from 7 to 9. Tomorrow, again, it'll be back here at San Juan College from 7 a.m. to 9 a.m. You're asked to pre-register ahead of time at the New Mexico Health Department. On Tuesday, again in the evening, will be another opportunity here at San Juan College. So if 7 a.m. doesn't work, maybe 6 p.m. to 7 p.m. would work here at the college. Wednesday, they're back over in Kirtland at Judy Nelson School, 8 to 9 a.m. That's a little different time. And then Thursday morning, July 23rd, back here at San Juan College, 7 a.m. to 9 a.m., the New Mexico Department of Health. And we certainly know that there are other clinics and urgent care is doing testing as well in the community. I think with insurance for most of those. This one, I think it doesn't matter if you have insurance or don't have insurance, they will test you for free.
Right.
It's a mandate from the state, and we're one of the, I think, very few states that are offering that at no cost, the number of tests that we have. But anyways, so yeah. You want to talk about numbers.
I do.
And we can do that next because we have the Johns Hopkins dashboard ready to go.
Good.
There it is.
I know. I was, quick for us.
Right.
We're back on our game, huh?
Somebody did some show prep today.
Yes.
So, yeah.
So, a total of 56,759 new cases of COVID-19 were confirmed just yesterday, and 7.4% of the 768,823 tests reported coming back positive, which actually is a lower number than we've seen as far as testing coming back positive. It's usually around 10%. For whatever reason, it was 7.4% yesterday. I mean, I don't really know why.
Okay.
That's a question for physicians, maybe, and epidemiologists. But,
right.
And then we had 381 new deaths attributed to the virus Sunday. And here's our total death toll so far in the United States of America, 140,500.
Right.
So.
Yes.
Which is a big number.
It is a big
It's
number.
a big number.
It's true. And we're seeing, we're seeing records, I think, still in the United States with new cases and what you were talking about. So
correct.
So there is that. In New Mexico, again, we are at 16,971 cases. This is the dashboard from the New Mexico Department of Health. And you can kind of see that. We have 469,215 hospitalizations total. Currently, it's about 2,300, almost 2,400, 161 deaths, and 6,764 recoveries. I'm reading the wrong numbers.
Right. 571 is the total deaths.
Yes, thank you. Pardon me. There you go. Current hospitalizations are 161 people.
Correct.
So if we go to San Juan County, and again, a little bit hard to see on the video screen there, but we can see our latest number of cases were 2,834. Total deaths in our county, 176. Total recovered in our county is 1,599, and there's been almost 30,000 tests that have been administered here in the county.
Yeah, and if you could scroll down just a bit, I'm interested in the age breakdown, because we see the gender breakdown is pretty much half and half, actually.
Right.
As far as who contracts the virus or
if this was the actual website, I would scroll down, but it's a screenshot. So I'm not going to be able to scroll down.
Okay. So go to the website.
You can go to the dashboard
and
see it.
And you can see it.
Exactly. And again, here in San Juan County, we only had 6 new cases reported on Sunday, which I thought was significant. That's pretty low. No new deaths in San Juan County reported on Sunday. Across the state, there's still 241. So again, we're seeing the biggest numbers, I think, coming from, as Secretary McCamley was saying, Las Cruces and its proximity to El Paso. I think there's a lot of crossover there, which is concerning to the state folks. Bernalillo County, I think, still has a lot of cases coming in. That's Albuquerque. But actually, Northwest, I think we've kind of got our numbers under control at the moment, and that's kudos to the folks who live here.
Yes. Following the guidelines.
So there's that. The other stories we want to pass along, again, from our website, ksje.com. Updated Navajo Nation numbers from over the weekend. They had 32 new cases and 3 additional deaths. That was on Saturday numbers. La Plata County, Colorado, had about 34 additional cases since the last time we updated that story, which was maybe about a month or so, 3 weeks ago. And so there is that. And up in Montezuma County, 11 new cases in the Cortez area. And a note of the second positive case here reported at San Juan College, and that was in a visitor to the college, not necessarily an employee. The employee was the first case. This now is the second case at a visitor to the campus here at San Juan College. And then, of course, the local restaurants that were still violating the public health order on Monday to just do dine out and outdoors and delivery and curbside pickup services had their food service permits suspended by the state Environment Department. So there's that story on our website as well. So there you go. That's, I think, the latest that
That's
we
the
have
latest.
for everybody.
So is it time for interesting story time?
Yes.
Okay.
Well, yes, of course. Always from you. Every story is interesting.
Aww. Are you going to chase that with some sort of...
No.
Yeah. Oh, cool.
I'm going to
Okay,
leave it.
cool.
I'm going to let it
Wow.
linger out there as a
I'm gonna
nice
savor that
compliment. Yes.
moment.
What's
No,
going on? What do you got?
Right, and so this is related to what Secretary of Workforce Development...
Workforce Solutions.
Solution.
Secretary McCamley.
Yes, thank you. So many words this morning.
Understood.
From my head. So West Virginia, I heard a story about West Virginia and about the transition from coal mining, because coal mining is a dangerous profession as is, but it's also a hotbed for spreading the virus. You're all there together. There's not a lot of ventilation in a coal mine,
Right.
as you might imagine.
Sure.
You're already having lung difficulties usually if you're working in a coal mine. So they're switching to focusing heavily on outdoor recreation. And there are quite a number of beautiful spots in West Virginia. It's near a mountain range. There's tons of rivers and forests and what have you. And so, and of course, right now everybody wants to be outside because that limits the spread.
Right.
And
Interesting.
so I thought that was really interesting, talking about a state that's known for one industry that is now trying to switch to a different one, but also as it pertains to the Four Corners area. I mean, we have amazing recreational opportunities, and one of our initiatives, I know, is to focus more on that part of the economy as
Right.
well.
Sure.
So, so this is a positive story because, again, just like I asked the secretary, what are the new industries? Where's that possibility? As much as we, of course, grieve and struggle with the loss of some of these other industries, for now, what else is out there that we can be doing?
Sure. Well, and again, what's the world going to look like post COVID-19? Yeah, we're going to be wanting to be outside more, and we'll be wanting to travel to less populated parts of our country and
Sure.
world to vacation in.
Right, and as online, I would say online mastery or capability or bandwidth or whatever increases because it has to. What are the opportunities for people living in populated areas, moving from popular areas to less populated areas, but still having their same jobs and working remotely? Like, this could really change the dynamic in maybe a more interesting and positive way.
Right.
So,
Well, I definitely think, I think a lot of folks are learning that they can do their job from home. And now if they can do their job from home, why are they living where they're living? Maybe they could live where they would like to live
Yeah.
in order for recreational
Cheaper
opportunities
and-
and still do their big city job from a smaller town
yeah.
or city.
Right, and who knows? I mean, necessity is the mother of invention, as they say, and it's unfortunate that this is how we have to learn
Right.
and do this, but maybe there's hope yet.
Maybe there is. I'd like to think so.
I think so.
Yeah. So there you go. All right. Well, we're going to wrap up things today,
Yep.
but we'll be back on Thursday, everybody. And again, we always post all the updates on our website, ksje.com. If there's any new COVID news to share, that's where you'll find it as well. And we'll update you on Thursday right here at 9 o'clock on KSJE, YouTube and Facebook page, on the radio this afternoon at 5:06 p.m. and, of course, at noon every day on KNMI Mondays and Thursdays, Vertical Radio.
Great.
So until Thursday,
See you next
stay
time.
well, wear your masks, wash your hands. See you Thursday.